Hi there. I'm happy to be here. I'm Kirsty Alm. I'm from Face Holographic Imaging. It's a Swedish-based company working on quantitative face imaging. And I'm here to talk about cell-friendly quality analysis based on imaging. So, just short about PHI. We have been around, Face Holographic Imaging, PHI. We have been around since about 2004. We have about 300 units all over the world installed. We have an office in Sweden, we have an office in the UK, and two in the US actually, 2 US offices by now. Our customers are all over the world, and they're in all kinds of fields, mainly academic, but also in some early settings of research in companies. And make this one do what I want. Yay! So, right now there is a paradigm shift where cells go from being tools that we use to understand our product, to understand a drug or to understand. And for that end, cells are killed. They're analyzed and killed. Now cells need to be the product, the living, kicking, vital product that does what it's supposed to do. So suddenly we need to treat cells like they are our most precious co-workers. They need to be happy at their job so we can then bring them to the patients. For that, cell quality analysis need to be revisited a bit. No more fluorescence microscopy killing off the cells, for example. So what we hope is to reach the cell-friendly quality analysis. And we need that. You can see here, there are so many early I'm sorry, I lose my English words right now. Inventions, people cure all kinds of illnesses using fantastic medical steps forward. There are so many things that are suddenly within our reach that used to be magic. There is even long lists of FDA-approved and other region-approved therapeutics, but they're all in early stages. They treat tens, maximum hundreds of patients, and we need to reach millions. So that's the challenge going forward. And that challenge we have to meet by making it safe. We have to make the product affordable, and we have to make it accessible. And that cell quality control is vital. So, what I'm trying to show you now is that quantitative face imaging is a really, really good option for cell quality control. So, in essence, quantitative face imaging, QPI, is based on how the light waves will pass through the cells. Whenever the light passes through, even invisible little things like cells, the light will be slightly delayed. And that delay is what is measured using quantitative face imaging. No labels, no stains, very low intensity light, no cell damage, just happily living cells. And then, because it's based on the light wave that is delayed, you get hard data out, really hard data, both on the individual cells, the shape, the size, what they are doing. They have no secrets. We are kind of like the Secret Service or FBI or something. And on the cell populations, cell numbers, cell proliferation, confluency, and you get the hard data out. Right now, our academic friends are struggling with these data sheets, giving them so much data. And we really look forward to AI putting their hands into this and making that doable in less than all the struggles that the PhD students are right now putting into it. What we really don't know yet is what of all the data is important. The QPI can supply so much data. So that's for the future to know. So we just store it all. What we can see going forward, what I tried to make here is some kind of cycle of manufacturing. And you can see there are little green check marks all over the place. That's where we, thinking in our own heads, think that quality control might be necessary. Cell-friendly quality control. So you can have the maximum expansion of your cells, the maximum benefit from everything. But we don't know that as yet. We don't know how much quality control is needed straight after extraction from a patient, or during transport, or at the manufacturing sites. We don't know that yet. So, sorry about that. So we are looking into this, trying to find out what happens. And to do that, we are networking, we are cooperating. And right now, we are working with a lot of different societies is not the right word, because some of them are not societies, but still, abbreviations. We work with a lot of abbreviations. A lot of them are situated in North Carolina, in the US. They have a really good hub for regenerative medicine there. And there goes the RMMS and the REMDO and the regenerator test bed and things like that. They have a whole huge setup where small companies can come in and test stuff, and where we are part of that testing. The regenerator test bed is a mini production facility where our unit is in there and people can try that for quality control. The ATP in Sweden, ATMP Sweden, has just started up. And I'm a proud member of ARM, as is my company, which is good. So we try to connect everywhere, try to understand where we have the most use of cell-friendly cell quality control. So right now we have 2 big projects going. One is bigger than the other, and this is the biggest one. We call it the Smart Manufacturing Project. And we do that in cooperation with SAS, who handles a lot of data in the US. They can do anything with data, they're wizards. We have QIAGEN on board for RNA and DNA analysis. Biospherics supplies huge chambers where you can have a chain of manufacturing without never taking the cells out. They're totally closed off. And you get this kind of space-thin gloves inside, and you can work totally closed off. Even the cell incubators are in there. As is our unit for quantitative phase imaging. And we work together with Wake Forest Institute for Regenerative Medicine on this. They are world-leading people when it comes to cells and regenerative medicine. So we feel we're in a good context, and the project is to find out, through this small production chain, how much of our data can we store away, analyze directly, keep for later, and in what format. Data handling is going to be one of the larger problems going forward. So what we are thinking of, it might not work, but we're trying it out. You always have to try everything, right? But we believe in this. When your kids go to school, they have something like a report card, right? They bring it home every year, and the teacher will put in notes, and it will follow the student through the years in the school. We envision something similar, but with cell data. You have your batch of cells, and they have the data, and then that follows through and through the patient. And in 90 years, when that kid who was treated for diabetes when he was 3 dies, you will have the data from the entire period of time. That will be invaluable in understanding what is important and not. What things do we need to tweak in the production? What do we need to understand? But what we also hope to show through this project is that using only imaging, you can actually predict if your sample is going to be good or bad, which means that you can either tweak the process early, or you can even stop the process and get the new sample from the patient very early through imaging, non-destructively, in line with your process. The other project that we're currently working with is in precision oncology. We are working with the Huntsman Cancer Institute in Utah, also the US, with Rob Judson, Dr. Rob Judson-Torres. It's just early starts. We have just said we are going to do this. So I'm really looking forward to see what Rob can do with our quality analysis. Okay, for our future now, what we're looking to do next, we want to look through every step in the manufacturing process. We need to define what needs are there for quality control. We need to find partners, and we need to develop suitable products. Our beautiful little product unit that is now all over the world might not be suitable at all for what we need, but we need to develop something better, larger, more beautiful, that can produce huge amounts of data for all of you. We are quite open to if someone has an interesting project or anything, please contact us in this regard. Okay. I'm actually already done. I'm sorry. I know I was probably supposed to speak another couple of minutes, but I'm happy if you have questions. Thank you.